Let's continue. Let me replay the video of the stereostatic pallidotomy. I don't know why we were interrupted before. So you can see the patient here. This is pre-procedure. He is out of control. He doesn't have control in his movements. You're going to see the way he walks. And then you are going to see after the procedure, only 42 years old. What a difference. He's able to control the movements and probably he's following commands right now. Look the way he's walking. Excellent. And now we're going to watch the other video. Is the other surgery that is available right now for Parkinson disease patients. This is another procedure called
People
the deep
suffering
brain
from ailments like tremors and Parkinson's
stimulation.
disease rely on and a series of chemical reactions that leads to the release of neurotransmitters. Together, these actions help correct malfunctioning connections in the brain. This is how DBS works. A neurologist and other specialists use MRI and CT scans of the patient to map out and hone in on the location of the brain that will be targeted. Doctors then surgically implant electrodes on the targeted areas of a patient's brain using a thin probe called a lead. A wire attached to the lead runs through the head, neck, and shoulder under the skin to the chest area, where it attaches to a battery-charged pulse generator that initiates electrical impulses. Then doctors turn on the lead, sending an electrical current to the brain. The patient, now awake, may be asked to move an arm, for example, so doctors can ensure that electrodes are precisely placed. A few weeks after the surgery, the patient visits a neurology specialist who programs how strong of a pulse the device delivers, how long it lasts, and how many times per second the electrical pulses are delivered. Once the DBS device is programmed, it delivers continuous electrical stimulation day in and day out. Doctors tweak the voltage and other settings depending on individual patient profiles and what DBS is used to treat.
Thank you so much. This video was great. We are blessed here in the US to have this type of procedures covered in a huge percentage by the insurance. In other cases, they are covered 100%. In my country, in Peru, in many countries in Latin America, these procedures are so expensive, the patients cannot get access to them. I'm talking about thousands and thousands, maybe more than $20,000-$30,000 just to get these little machines. And the other problem is that the batteries, you need to change the batteries, right, of in order for that machine work. So you need to pay for the doctor to double check if the electrodes are providing enough energy to the neurons. So that's the doctor's visit that needs to be paid. It's not covered by the insurance in some countries. Now you have to pay for the machine, and also you have to buy the batteries. Sometimes not even the batteries are available. So we are blessed we are having those here. Okay, so this is typically not an option when medications are working. Okay, so that's why that is one of the requirements in the US. They are going to assess if you are under medications. If the medications are working, there is no need for the deep brain stimulation procedure to be done. But if the medications are not working, then you have a reason, right? So basically, we need to monitor cognitive dysfunction. And in terms of that, 50% of patients with PD have cognitive dysfunction, usually develops later as the disease progresses. We have a drug, pimavanserin for Parkinson's disease related to hallucinations and delusions. And patients who have been diagnosed with cardiac dysrhythmias should not take this medication, pimavanserin, because it can prolong the QT interval. I'm sure you're going to get this EKG training in the following semester, in the next semester. Teach patients and their families to report any irregular heart rhythm to their primary healthcare provider immediately. In addition, the concurrent use of strong CYP3A4 inhibitors, such as ketoconazole, which is an antifungal, clarithromycin, which is an antibiotic, itraconazole, another antifungal, can increase the activity of pimavanserin. So you have to watch for the liver function on this, and this is good to know because these cells, the cells in the liver, are going to be affected by the CYP3A4 inhibitors and the other medications that we just mentioned, okay? In this case, the healthcare provider should prescribe pimavanserin in a very low dose if we consider the benefits versus the danger, right? You always need to analyze this. Okay, I am going to review this. So if the patient is taking CYP3A4 inhibitors, such as ketoconazole, clarithromycin, itraconazole, if the patient is already taking, and if the provider considers to prescribe pimavanserin, then he has to start this medication in a very low dose because, okay, this can affect the rhythm, the heart rhythm of the patient. Okay? Okay. Okay. Patients who have been diagnosed with cardiac dysrhythmias. I'm going to repeat it because this is very important. It's good to know. Should not take pimavanserin because it can prolong the QT interval. This medication works. The adverse event is, it's not the adverse event, but affects the QT interval. Teach patients and their families to report any irregular rhythm to their primary care health provider immediately. Okay? So they are taking that medication, immediately inform about changes in the cardiac area. In addition, the concurrent use of these inhibitors such as ketoconazole, can increase the activity of pimavanserin. So, if they are taking the antifungal, the antibiotic, these medications can increase the problem with the heart that pimavanserin can cause. Is it clear now? I hope it is. Okay. Care coordination and transition management. Home care preparation, impaired mobility and cognition can affect the patient's daily lifestyle and self-concept, including sexuality. The care manager or other healthcare providers uses a holistic approach to ensure that both psychosocial and physical needs are addressed. Self-management education. Most important is to take the medication at the right time, reminding to immediately report adverse effects of medications such as dizziness, fall, acute confusion, delirium, hallucinations. Teach family members or other caregivers to maintain or improving the patient's quality of life by helping to alleviate or manage symptoms. For example, constipation, again, we are talking about constipation once again, can be managed by encourage added fluid, high fiber, and regular bowel training program, even with suppositories and bulking forming laxative. Also, we need to monitor the sleep disorders. We can provide and teach the patient with good sleep hygiene programs, including avoiding alcohol and caffeine, darkening the bedroom, and performing bedtime rituals. I will suggest also to stop any any nutritional habit 3 to 4 hours before the bedtime. Okay, no fluids, because we don't want the patient to feel like urinated in the middle of the night. No fluids, no food, 3 to 4 hours before the bedtime. Okay, and that's good to know. English material. Neuropsychiatric health problems such as impulse control disorders, altered recognition, anxiety, and depression can be very difficult for both the patient and family. So probably respite care is going to be necessary. Healthcare resources. Collaborate with the social worker or case manager to help the family with financial and health insurance issues, such as respite care or permanent placement if needed. As the disease progresses and drug effectiveness decreases, refer the family to a palliative care organization or hospice care for end of life. Um, Professor, why are you reading this? This is obvious. This is logical. It makes sense. This stuff makes sense, we okay. Well, when you're in the hospital, sometimes nurses, they don't understand what they need to do when the patient is going to be discharged. They need to get in contact with the nurse, the social worker, the how they call nurse case management, so they can arrange all these factors. Now, let's say you don't work in a hospital and you work for an agency, home healthcare agency, right? Then you need to put all these type of resources together. So you need to be informed about this, okay? Migraine, headache. Most individuals experience some type of headache during their time from a variety of causes, such as low blood sugar, sinus infection, alcohol, and stress. In other terms, migraine is not only a nervous condition. It could be caused by nutritional, like low blood sugar, an infection, high intake of substances, in this case alcohol, and stress. These headaches are acute and temporary and often resolved by managing the cause of the headache. By managing the cause of the headache, I would say by preventing the cause of the headache. To make lifestyle changes is going to improve the presentation of the migraine. Also is going to be solved with mild analgesics such as acetaminophen. And acetaminophen, we have to get this carefully because this can cause liver problems. So be careful, okay? Some adults have specific types of headaches that can cause fever, debilitating pain, and recur. The most common type is migraine headache. This type of headache is most likely to affect quality of life when compared with other less common types. So, the pathophysiology and migraine headache is a common clinical syndrome characterized by current episodic attack of head pain that serve no protective purpose. This migraine headache pain is usually described as throbbing and unilateral, and that's good to know, unilateral. So that is going to give you a hint. Whenever you have a headache, you can differentiate if it's a regular headache or is a migraine, right? Or is a stress-related headache. Nausea and vomiting, nausea or sensitivity to light, sound, or head movement can last from 4 to 72 hours. 72 hours is equal to 3 days, 4 hours to 3 days. They tend to be familial, and women are affected more commonly than men. Women diagnosed with migraines are more likely to have major depressive disorder. I want to stop here. Major depressive disorders. In functional medicine, which is the type of medicine that looks for prevention before the conditions occur, is different from the current medicine nurses we are working for. Nurses, we are working for the conventional medicine, in which we treat the patients and we basically treat the symptoms after the condition develops. Okay, so in functional medicine, when we have a presentation of patient with migraine headache, we first analyze what are the psychosocial factors around the patient, what is causing the depression, if present, right? So we analyze if they are having a good relation with the family, if they are having what type of stress they are having. We are trying to work on that in order to avoid the medications that we are going to talk in a few minutes. Migraine sufferers are also at risk for stroke and epilepsy. So you need to work on what is causing the migraine. Why? Because it could cause a stroke and epilepsy, but the medications also that the patient is going to start to take, overdose or the strength of the medication can lead to this stroke and epilepsy. Okay, pay attention because this is very common. So neurotransmitter calcitonin gene related peptide CGRP is a potent vasodilator released during a migraine and is thought to play a major role in the sensation of migraine related pain. Genetic, hormonal, and environmental factors may play a role as well. So when you have a patient with migraine in front of you, you want to check how is the psychosocial, what is causing the stress, if the patient is having a depression, what is the age of the patient, is the patient in the perimenopause period, is the patient in menopause, are there any hormonal changes? Maybe the patient is taking contraceptives that are causing hormonal changes. Maybe there is genetic. Maybe the mother has suffered from migraines. What environmental factors may play a role? For example, is the patient consuming this type of alcohol or drugs, or what type of nutrition? All these factors we need to analyze, okay? So let's watch this video about migraine. Okay, I need to get better on this. Okay, here we go.
Migraine is a chronic neurological condition involving repeated headaches that are frequently severe and are accompanied by other symptoms, such as nausea, vomiting, and an increased sensitivity to light or sound. Migraine headaches are often throbbing, experienced on one side of the head, and worsened by movement or physical activity. About 1/3 of migraine sufferers experience a migraine aura, which consists of neurological symptoms such as visual disturbances that occur before or during the onset of pain. The headache phase of a migraine is thought to be attributable to the activation of the trigeminal nerve, a cranial nerve that acts as the main sensory nerve for the head. The trigeminal nerve supplies a variety of pain-sensitive structures, including the eye, dura mater, and various blood vessels. Activation of the trigeminal nerve can elicit pain in these structures, which might explain the characteristic head and eye pain of migraine. Activation of the trigeminal nerve also prompts the release of neurotransmitters that can dilate cranial blood vessels and further stimulate and sensitize pain receptors. Additionally, trigeminal nerve fibers synapse on neurons that project to various brain regions, and these connections might be responsible for eliciting other common symptoms, such as auditory, visual, emotional, and cognitive effects. People who experience migraines may undergo neurological changes that increase sensitivity to migraine triggers, but it's still not completely clear what causes a migraine attack to begin. Migraine aura has been linked to a spreading abnormality in the electrical activity in the brain known as cortical spreading depression, which prompts other alterations in brain activity and is linked to the activation of the trigeminal system. This spreading depression has been suggested as a mechanism for the initiation of migraine without aura as well, although there is no consensus on this point, and other mechanisms that lead to trigeminal nerve stimulation may be involved.
Thank you so much. Guys, I know this chapter is long, but you are preparing also for your HESI and your NCLEX by doing this reading, okay? And also all of you who wants to become a nurse practitioner, you need to know how to get into the habit of reading and analyzing. You need to know the story. I don't want you to learn only the facts. And the PowerPoint is very basic. It's only giving you the headlines, the headers of the topics. So all these factors cannot be summarized if you don't do your reading, basically, okay? Okay, let's continue with this. So we saw already the causes and all the pathophysiology of migraine. As cerebral arteries dilate, okay, prostaglandins, which are chemicals that cause inflammation and swelling, are released. Vasodilation, in turn, allows prostaglandins and other intravascular molecules to leak extravasate, contributing to widespread tissue swelling and the sensation of throbbing pain. So basically, this is exactly what happened during migraines. We have a cerebral artery that is dilating, and the action of the prostaglandins is causing inflammation and swelling. And actually, that prostaglandin also is causing the pain during menstrual period. Okay, it's something else that we're going to talk later in other chapters. But the prostaglandins basically cause inflammation and swelling. And if the prostaglandins enters, right, these arteries, is going to cause intravascular molecules to leak. The extravasation is the one that is going to cause the spreading sensation of swelling and pain and throbbing pain. Many patients find that certain factors or triggers such as caffeine, red wine, or the monosodium glutamate tend to cause migraine headache attacks. So in the supplemental material, which is a file that I'm going to submit to you after I finish with this chapter, I am uploading the videos, but the supplemental material is coming in the announcement. You're going to see a file of monosodium glutamate. All the foods that comes with monosodium glutamate. For example, there is a few lists here. For example, carrot, onion, cabbage, potato, egg yolk, cheeses again, soy sauce, anchovies, shrimp, grapes, tomato, mushrooms. Foods that are produced through fermentation such as molasses, sugarcane, sugar beet, beans, mushroom, and seaweed. Other foods that are aged or cured such as Parmesan cheese that we love, Roquefort cheese, bacon, pepperoni, and ham. Foods that are heavily processed such as canned soups, prepackaged deli meats, frozen food, chips, or other snacks. That's why whenever I enter the class and I am watching what you're eating and I find people eating pizzas, all the wrong stuff you are getting. Foods that are seasoned with MSG, such as fast food and restaurant meals, condiments, seasoning blends, soups, and instant blah, blah, blah. So we need to be aware of the monosodium glutamate food. Also, other causes that triggers migraine are high intensity light, stress, excessive fatigue, changing weather, tyramine containing products such as pickle products, aged cheeses again, smoked sausages and beer, preservatives, artificial sweeteners. Artificial sweeteners, your Splenda, your what is the other one? I don't even remember. I don't get that. Sweet and low, Splendas, preservatives, all those that are coming in the packages and the cans. Stay away from that, please, because of the nitrates. Okay, recognizing the cues. Migraines fall into two major categories. This is important. Is either migraines with aura or migraines without aura. And they can also be classified as chronic or episodic. An aura is a temporary symptom in the cerebral nervous system, visual changes. The typical, I would say the most common presentation of aura is the visual disturbances, and that's good to know, okay, in a migraine. And that signals the onset of a migraine headache. If accompanied by an aura, it will occur immediately before the migraine episode, although an aura can occur without a headache. So you can have a visual disturbance without a headache. Most headaches are migraines without aura. That's true. Migraines are classified as chronic if they occur on at least 15 days of the month and are episodic if they occur less frequently. Some people have a prodrome that occurs 1 to 2 days before a migraine. The diagnosis of migraine headache is based on the patient's history and on physical, neurologic, and psychosocial assessment. As I told you, we need to double check what's going on around the patient, okay? Besides stress, what is causing that stress, that depression, okay? Same signs and symptoms each time are going to be very common, and we need to be able to identify them. Refrain from regular activities for several days if they cannot control or relieve the pain in this early stage. Neuroimaging such as MRI may be indicated if a migraneous infarction is suspected, or if the patient has other neurologic findings, a history of seizures, findings not consistent with a migraine, or a change in the severity of the symptoms or frequency of the attacks. Women with a history of migraines with visual symptoms may have an increased risk for stroke. That's why it's so important to identify the migraine. The presentation is so important. You observe, you assess how the presentation is, particularly if a migraine with visual symptoms occurred in the past year. So there is a risk factor for cardiovascular disease with all these symptoms. Here you have a table. You can check on this table. There are also neurologic changes besides the visual disturbance, numbness, tingling of the lips or tongue. I would say that is frequent as well. Some other women would have vertigo or drowsiness. And this is good to know. Anything related to visual disturbances, because it's very common. Then you have the migraine phase itself, the headache, if it's unilateral, frontotemporal, throbbing pain, the migraine without aura. You have the pain aggravated by performing routine physical activities, pain that is unilateral and pulsating, phonophobia, which is sound sensitivity, photophobia, light sensitivity, migraine often occurring in the early morning during periods of stress or in those with premenstrual tension or fluid retention. Again, it could be the perimenopause because of fluid retention, hormonal changes, okay? So you have to apply your critical thinking here. Take actions, interventions for pain management. This outcome may be achieved by abortive and or preventive therapy. Drug therapy, trigger management, and complementary and integrative therapies are the major approaches to care. My gift to you, nurses, is going to be this video. It's not only for migraines, but it's gonna work wonders if you know or you're having problem with migraines. This is called pranayama. These are breathing techniques that I use personally, and it works wonders to release anxiety also.
For this, you move your right hand to Vishnu Mudra, that is your index and middle finger bent, and you use only your thumb and your ring finger to block your nostrils. We'll be inhaling to 4 counts, retaining to 16 counts, and exhaling to 8 counts. That's the final stage of practice. If you want, you first begin with just inhaling to 4 counts and exhaling to 8 counts. Block your right nostril with your right thumb and exhale completely on the left. I will begin on the left side, inhaling Om 1, Om 2, Om 3, Om 4. Hold your breath, block both your nostrils to 16 counts. Exhaling to 8, 1, 2, 3, 4, 5, 6, 7, 8. Now inhale on your right. Om 1, Om 2, Om 3, Om 4. Hold 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Exhale on your left. 2, 3, 4, 5, 6, 7, 8. This completes one round. Every time you exhale from the left, you take it as one round and you do a minimum of 6 rounds like this.
This is another
It
type of
almost sounds like a
pranayama.
soft snoring sound. How you do it is, imagine you have a glass in front of you and you want to fog it up with your breath. So you'll blow ha, right? So just do the same thing but with your mouth closed. So it causes a small constriction to your throat and it sounds like this. So you breathe in. So it almost sounds like the soft sound of an ocean, right? And if you can maintain this breath through the entire practice, you'll find that you're able to hold asanas a lot longer without your muscles quivering and your mind darting about everywhere.
Take your index finger, you place it in the cartilage of your ear. You press it in and you inhale through your nose and exhale through your mouth, making the humming bee noise. So I'll just show you how it's done.
Thank you so much. So nurses, dear students, you can fast forward if you don't want to watch these videos and you want to just get the specific information. My role as an educator is to provide you with a complete scenario, with the complete information. I'm not going to sleep good. I'm not going to have a good sleep if I don't give you all the information you need to be successful, not only in this semester, but also in the future in your life. So I provide you with all the information. You are free to take it. Okay? It's up to you. I put all the tools on the table. So this video is helping you. Is the way I usually relieve anxiety when I'm working. During pandemic, it was really helpful. During exam times, also it was helping me. Anxiety needs to be controlled, especially if you're gonna work your first year of nursing. It's gonna be hard. You need to have stress management techniques. Okay, so we were talking about the abortive therapies. They are aimed at alleviating pain during the aura phase, if present, or soon after the headaches has started. Some of the drugs used have major side effects, contraindication, and nursing implications. Some of the drug use have major side effects. The primary healthcare provider must consider any other medical condition that the patient has when prescribing drug therapy. It's not good to self-prescribe if you have chronic conditions and you have migraines. You need to be seen by the doctor. In general, the patient is started on a low dose that is increased until the desired clinical effect is obtained. Mild migraines may be relieved by acetaminophen, your Tylenol. Remember, liver toxicity. Okay? NSAIDs, such as ibuprofen and naproxen, may also be prescribed. These NSAIDs work in the stomach, can cause bleeding, your ibuprofen, right? Several other over-the-counter drugs combined with caffeine for migraines are available. Caffeine narrows blood vessels by blocking adenosine, which dilates vessels and increases inflammation. So adenosine dilates the vessels and increases inflammation. And caffeine narrows blood vessels. critical thinking. If we are using caffeine to narrow the blood vessels, how much oxygen are we reducing right there by narrowing the blood vessel? Okay, just think about it. Antiemetics may be prescribed to relieve nausea and vomiting. Metoclopramide may be administered with NSAIDs to promote gastric emptying and decrease vomiting. Okay. For more severe migraines, drugs such as triptans, dictans, ergotamine derivatives, and isometemptine combinations are often needed. A potential side effect of these drugs is rebound headache, also known as medication overuse headache. So all medications used for a long term are going to cause overuse effects, in which another headache occurs right after the drug relieves the initial migraine. So you're taking a medication which is higher in strength, and this is going to help you relieve the pain. And after the medication effect disappears, then you're getting back to the headache. And then you're going to start looking for a more serious and one level up medication. Triptan preparations relieve the headache and associated symptoms by activating the 5-HT serotonin receptors on the cranial arteries, the basilar arteries, and the blood vessels of the dura mater to promote a vasoconstrictive effect. So examples are sumatriptan, elatriptan, naratriptan, and almotriptan. And I want you to know what is the basilar, because you need to know how this medication is going to work. But you don't know what is the basilar. We always talk about the femoral, the artery, the carotid, but we need to know about the basilar arteries. There's a problem here. Okay. One more. Let me see. Here we go. Okay. Here we go.
The experts from both sides come to the stand and explain to you that the arteries of the body form an interconnected system carrying blood throughout the body, but that sometimes clots can block flow, leading to serious complications. The defendant then explains how wires and tubes can be passed from the groin up to the head via these arteries to physically remove these clots. Do you think you're going to be able to understand this? As the old saying goes, a picture is worth 1,000 words. But what if you had 1,000 pictures? Now you're really getting somewhere. An animation is a series of images that increases the educational value of the presentation exponentially. Let's watch as this animation reveals the advancement of a guide wire from the groin up to the brain. With such a concise depiction, there's no possibility of miscommunication. In a similar fashion, this additional segment of the animation shows how a mechanical thrombectomy device can be deployed and withdrawn to eliminate clots within the vessel. Imagine trying to visualize this device and this technique without being able to see it. And yet, a short animation segment makes everything clear and understandable.
Yes, so he's removing the clot that is formed in the basilar artery. The main purpose of this video was to teach you where the basilar artery was, which is all the way in next to the brain stem, okay, in the brain. So we have this one, you know where is it, and you know that triptans relieve the headache and associated symptoms by activating the 5-HT receptors on the cranial arteries and the basilar arteries. So what is happening, that these triptans are going to quickly, effectively relieve the pain, nausea, vomiting, and light and sound sensitivity with few side effects. However, sumatriptan may cause chest pain. Therefore, most triptans are contraindicated in patients with actual or suspected ischemic heart attack, heart disease, cerebrovascular ischemia, hypertension, and peripheral vascular disease. And this is good to know. So if sumatriptan is gonna cause chest pain, think about the patients that are having chronic conditions related to the cardiac system. Okay, that's the safety priority here, right there. Patients taking sumatriptan. Teach patient taking triptan. Okay, drugs to take them as soon as migraine symptoms develop. Yes, this is the protocol. Instruct patients to report angina, chest pain, or chair discomfort to their primary health provider. This is coming in the exam. So watch the alert for patients under sumatriptan. Preventive drug therapy is used when a migraine occurs more than twice per month. The duration of the headache is greater than 24 hours. The headache interferes with ADL for 3 or more days. And all these factors you should assess in patients, including you girls. I'm totally sure, guys, that you sometimes got migraines and you need to identify how is your condition, how you're going to treat, what you're going to tell the doctor whenever you go to the provider for this. Abortive medications are used more than twice a week, or the headache is not relieved with acute treatment. That's what happens when we have migraines. We go and we self-prescribe, and then you start escalating the medication. Initially prescribed an NSAIDs, a beta-adrenergic blocker, a calcium channel blocker, or anti-epileptic drug. Propanolol and timolol are common beta blockers approved for migraine prevention. Hello, hello. If you didn't know, now you know. Propanolol and timolol. However, verapamil, a calcium channel blocker agent, may also be used for some patients. Remember this, both calcium channel blockers and beta blockers interfere with vasodilation, a contributing cause of migraine pain. So they really stop that vasodilation. Beta-adrenergic blockers or calcium channel blockers drugs can cause low blood pressure and decrease pulse rate. With these medications, you need to monitor 120/80 is your regular blood pressure. With the beta blockers, you need to monitor and hold the beta blockers if the systolic is less than 100 and the diastolic is less than 60. And of course, your heart rate, if your pulse is less than 60, also you need to hold on that. Okay, and this is the alert. You have to report bradycardia or adverse reactions such as fatigue and shortness of breath to their primary healthcare provider. There are other types of medications here, which is the NCLEX material. I want to talk about topiramate. Is one of the most common anti-epileptic drugs used for migraines, but it should be used in low doses because reports of suicides have been associated with this drug when it is used in large doses, most often in patients who have bipolar disorder. So this is good to know. NCLEX material. Nortriptyline is a tricyclic antidepressant that is often effective as a drug to prevent or reduce migraine episodes. Yes, I've seen this very often in the hospital. The drug is started in a low dose and may be increased depending on a patient's needs. Side effects include dry mouth, urinary retention, basically your anticholinergic side effects, and it shouldn't be used in older adults because it can also cause delirium, case, and confusion. I know the chapter is long, but if you are in the hospital and you see this prescription and the patient is already having urinary retention or constipation and you give this, what is going to happen is that the patient is going to get worse, you're going to lose your license, and then you're going to say, why I didn't pay attention to Professor Matalana presentation. The newest drugs for chronic migraine are in monoclonal antibody drugs, this class known as calcitonin gene-related peptide receptor antagonists. Examples of these drugs administered by injection. I've never seen this, but it's new, right? So you have the names here. This is for general information. So also the recommendations are that the patient should have a headache diary. Encourage them to report whether the headache is associated with new or unusual visual changes. We are trying to prevent stroke or seizures, right? And if the prescribed drug is no longer effective. Trigger avoidance and management is the most important here. For example, at the beginning of a migraine attack, the patient may be able to reduce pain by lying down and darkening the room. Yes, the patient may want both eyes covered and a cold cloth on the forehead and to be undisturbed until awakening. And in urgent care, when I used to work in urgent care, I have many patients coming to the clinic with migraines. So I usually put the patient in another room, darker, right? So I ask the patient to lie down. I dim the lights. I put some Reiki music in the room and ask the nurse assistant to bring some ice packs. And basically I put it there and let the patient relax. Ice packs works wonder, and this environment is very appropriate and is really helpful to reduce the migraine attack. So I've done it. I know what I'm talking about. Medical marijuana probably is going to be another choice. There is also external trigeminal nerve stimulator. One is very popular. I saw it in even Dr. O's show. It's called Cephali. It's a little device that you can place in the forehead, and it's going to it's like a headband that stimulates several branches of the trigeminal nerve associated with migraine attacks and pain. Complementary health and integrative therapies, as I told you, yoga, meditation, massage, exercise, and biofeedback are helpful in preventing or treating migraines for some patients. Vitamin B12, which is we're talking about the nerves. B12 is all about nerves, and magnesium supplements to maintain normal serum values may have a role in migraine prevention, especially magnesium. Acupuncture and acupressure may be effective in relieving pain for some patients. Honestly, to be completely honest, these techniques for breathing, the breathing techniques, the pranayama, can increase the oxygen in the brain, okay, and works wonders. You don't believe me? Try them. You're going to diminish the pain. The pain is going to be, after a few minutes, is going to go from 5 to 1. And your meditations techniques are going to help you, and your good nutrition as well. One last question here. The nurse is preparing a teaching plan for a client with migraine headaches. The client has been prescribed propranolol for prevention and sumatriptan for acute episodes. Which of the following statement would the nurse include in teaching this client? Take your pulse every day at around the same time. That will work with your propranolol. You are not going to report a pulse greater than 100 to your provider. Now, take vitamin D. No, we were talking about vitamin B12. Change position slowly when you first start propranolol. Yes, because of the patient, I hope they don't have bradycardia or orthostatic hypotension. Take the sumatriptan as soon as the symptoms begin. Yes, and report any episodes of chest pain to your provider, because that is a side effect of sumatriptan. Okay, we have finished migraines and Parkinson. When we come back, we're gonna check seizures, epilepsy, meningitis, and whatever is left on this long chapter. I know. Okay, students, take your time, little by little, but if you do it constantly, little by little, 1 video, 2 videos per day, you're gonna complete the studying the studying, the full studying, the course. Okay, thank you.